And to our continued coverage of the coronavirus pandemic, some health workers at the Lagos University Teaching Hospital, tagged Youth Initiative, are going through a tough time of battling to contain the COVID-19 pandemic and staying alive owing to poor welfare. Now, some of them who earn less than a national minimum wage are at the forefront of the fight against the pandemic without adequate protective equipment. In this report by senior correspondent Sharon Ijaso, they cried for assistance in form of better welfare and adequate protection, as some of them are already down with the novel coronavirus.
As more Nigerians, including political leaders, are testing positive for COVID-19 and going in and coming out of self-isolation, the lockdown ordered by the federal government is beginning to reveal with clear disbelief the abysmal and decadent state of Nigeria's healthcare system. Experts are of the view that the days ahead will show that despite the sacrifice by health workers, decades of neglect in the healthcare delivery system is going to haunt the country in a most devastating manner. This is disheartening for a country with some of the best human resources in the health sector, even within a global context. In addition, the issue of casualization of workers and outsourcing of staff have been the order of the day. Just before the COVID-19 pandemic, which is now described as a public health crisis, there has been debate on the need to criminalize contract staffing and outsourcing of workers. Some ward mates, technicians, oxygen attendants, and other employed under Youth Initiative Company are lamenting that though they offer essential services with the health facilities, they receive 14,743 naira as monthly wage.
Me that I'm talking to you, I buy my face mask myself. I buy my hand glove myself. Nothing is being given to us.
Recently, the chairman of House of Representative Committee on Housing, Wale Raji, initiated a bill to criminalize casualization of workers.
The Ninth Assembly of the House of Reps, feels concerned about it, and that motivated me, to come up with this bill to amend the Nigerian Labour Act such as to criminalize casualization, of workers.
The National Association of Nigerian Nurses and Midwives says many health workers are living in fear due to lack of insurance and inadequate hazard allowance for hazardous job.
Many health workers are positive. Presently, 30 nurses are positive to COVID-19 in Lagos State Public Health Care System, and over 400 are exposed to this virus.
In a recent interview with management of Youth, they reacted to the rise in infection amongst health workers.
Our healthcare providers in this hospital have had their own fair share of risks, and because of that, we do have a few that have come down positive in the course of doing their work, in the course of interacting with one another. And just like we recognize the impact, emotional impact that this pandemic is having on everybody, the healthcare worker is not excluded.
Though we still await reaction of the management to the plight of the casual workers in Youth, many citizens have continued to complain. The trend of smelling environment, debilitated structures, unkept and broken equipment, as well as lack of essential consumables, are still the order of the day in government hospitals. It is like double jeopardy for this set of workers who receive less than the minimum wage, yet they are more exposed to health hazards on the job due to the coronavirus pandemic. In the fight to halt the spread of coronavirus in Lagos, most of them are down with the virus due to poor protection. Sharon Ijaso, TVC News, Lagos.